Hello everyone, I am Dr. V. Mohan, Chairman of Dr. Mohan's Diabetes Specialty Center, and I've been doing a series of videos on the connection between diabetes and metabolic diseases and liver disease, particularly chronic liver disease. In the fourth of this series on the connection between diabetes and liver, I'll talk about the treatment of diabetes itself in those with chronic liver disease. So what's so special about treating diabetes or chronic liver disease? Remember that the proneness to hypoglycemia is very much increased in those who have chronic liver disease. So you have to be very careful when you use certain drugs. So let's start with lifestyle itself. When you have chronic liver disease and diabetes, the diet must be regulated. Small frequent feeds are good. You should not avoid carbohydrate completely, because don't try keto diet and all this funny stuff when you have liver disease. It can further damage the liver and make it worse. But if you have small frequent feeds with limited amounts of carbohydrate taken at different times along with some good protein, this could be very good for you. Of course, your exercise patterns can be tailored according to your needs. Now, coming to medication, if you look at the oral drugs that are used, sulfonylureas must be used with a little bit of caution, because you can get very severe hypoglycemia. With insulin also, the risk of hypoglycemia is there, but if you take small doses of insulin, split short-acting insulin, that's probably best for those with liver disease. But coming to the other drugs, there are some drugs which have been actually shown to have benefit on the liver. Metformin has always been believed to have some beneficial effect on the liver. Pioglitazone, there are some studies which show that it probably helps in chronic liver disease and in treating NASH and NAFLD. But the new kid on the block is the SGLT2 drugs. And we have the three prominent drugs, canagliflozin, dapagliflozin, and empagliflozin. There are specific trials being done nowadays which are showing improvement in chronic liver disease and in fatty liver by the use of these agents. They also help to reduce weight, so that could be another mechanism. The other group of drug, the GLP-1 receptor analogs, like liraglutide and dulaglutide, these have also been shown to be friendly to the liver, and they can help to reduce the fatty liver or even reverse it by, again, through mechanisms maybe directly on the liver or through loss of weight. So we have a number of drugs now to treat liver disease in conjunction with diabetes. But remember that both these conditions, if they are diagnosed very early, are eminently reversible. So we should put all our efforts in preventing chronic liver disease and preventing non-alcoholic fatty liver disease by having a healthy lifestyle, by having a healthy diet and exercise, by reducing weight right from a young age, so that the progression of this liver disease from NAFLD to NASH to cirrhosis can be prevented, because in early stages they are completely reversible. The hepatic triglycerides can come down, and with that the diabetes can also reverse. The same factors which produce diabetes produce liver disease. So by attacking the risk factors, you can get two birds with one stone. So you can reduce both these diseases. So now that NAFLD has become so common and diabetes has become more common, I think all of you should keep chronic liver disease in mind when treating people with diabetes, and you might have to adjust the dose and the anti-diabetic drugs that are given so that both conditions are taken care of. Thank you very much.